Hello and welcome, listeners, to our first ever episode on geriatric healthcare. As we know, COVID-19 is proving deadly for older adults across the world, yet it's been helpful in identifying some gaps for improvement in the system altogether. To discuss some of the issues, resolutions, and other commentary on geriatric healthcare in Canada, we have with us today Dr. Catherine Tong. Welcome to the podcast, Dr. Tong.
Yeah, thank you so much for having me.
It's a pleasure. Dr. Catherine Tong is a research associate with the Geriatric Health Systems Group at the University of Waterloo. Personally, I met her when she taught Gerontology 201 in fall 2019. She's a social gerontologist who, for the last 12 years, has completed research with older adults in receipt of home care, living in long-term care, and those who are community dwelling. Like many of her colleagues, she is currently exploring opportunities to support older adults during the COVID-19 pandemic, in addition to the aftermath and anticipated longer-term consequences. So Dr. Tong, I think we'll start off with the long-term care side of the discussion first. How and why do you think outbreaks in long-term care homes are as prominent as they are now?
Yeah, thanks, Hussain. So the majority of COVID-19 deaths in Canada, around 75% of deaths due to COVID have been in long-term care. And right now in Ontario, we have 167 outbreaks in long-term care homes. And because of those outbreaks, we've had at least 900 deaths of residents in long-term care and also two personal support workers. And because of this, there's been a lot of coverage and interviews with experts, and there's sort of a general consensus as to why this is happening. One, is first, some of this could have been avoided. In our preparations for COVID, and of course, hindsight's 2020, we were really myopically focused on hospitals and acute care. And even in our effort to free up space in beds in hospital, assuming there'd be this influx of COVID patients, we actually sent more vulnerable people into long-term care, getting them out of the hospitals. But the problem is then, of course, we moved frail older persons into congregate living situations where there are also a lot of frail older persons being housed together. Problematic, right? To the general consensus that the numbers I just gave you are most likely underreported, and we're assuming there actually are more deaths in long-term care that have not yet been captured in our reporting data. And finally, I think it's really important, and I'm not the only one saying this, the house was already on fire, so to speak, before COVID-19 struck. So, academics, staff, advocates, and unions have long been sounding the alarm. Unfortunately, we have a long history of neglecting, underfunding, and stigmatizing long-term care and home and community care in this country. And tragically, these deaths are a direct reflection of that. So what have we been sounding the alarm about? Long-term care homes have long been faced with chronic staff shortages. It's really hard to recruit and retain staff.
Yeah.
And most staff in long-term care, they don't get full-time work. And you'll remember we talked about this in class. They don't get full-time work. They're paid less than their hospital counterparts. And because they're not full-time with benefits, they don't get paid sick days, which when you're in a pandemic or any outbreak scenario, you don't want staff coming to work sick. But if they are low-wage employees without paid sick days, sometimes the decision between feeding your family and not going to work, that's a tough call to make.
For sure.
And also because they don't get full-time work in one facility, because that's more expensive for whoever's paying them, right? Then you have to pay benefits and whatnot. Because of that, workers end up working in multiple facilities. So they'll work in more than one long-term care home. Or we see a lot of workers working, some shifts in long-term care and some shifts in home care. And this is a practice that workers, they're kind of forced to do to make ends meet, not because they want to, and certainly not because it's funner or safer, and that's a really problematic practice when it comes to infection control.
Wow, that's very unfortunate, and it seems that a lot of the issues that we're experiencing today are as you said, just sort of a symptom of the neglect we've been seeing over the past number of years. Really unfortunate. So now that we sort of have a picture of the rationale behind these outbreaks, Dr. Tong, what do you think we can do to mitigate the harm and the risk?
Yeah, thank you. So, the good thing, I guess, as you can say, is that in the last few weeks, really, the few weeks, politicians have suddenly heard what people in this sector have been saying for a really long time. And some positive things have happened in terms of supporting staff and mitigating risk. And those go hand in hand. Supporting staff and mitigating risk go hand in hand. So workers in these facilities, including workers in home care, are getting the extra $4 an hour pandemic pay, which they absolutely deserve, and they deserve more than that. Also, what's interesting that's happened is on April 22nd, Ontario said workers can only work in one facility at a time during this COVID outbreak. That was April 22nd. That's a really important move, and that will save lives. In BC, that policy came into place almost a whole month earlier on March 26th. So there might be some learnings there. But what is interesting is here in Ontario, even though there was no provincial mandate, some facilities on their own chose to limit their staff to their facility and said, please staff, don't work anywhere else. And if you're not working anywhere else, we will give you full-time hours. And in those homes, so far, we have seen fewer outbreaks. So reducing that movement of staff from facility to facility has been helpful.
Wow.
And of course, throughout the world, and throughout COVID, we've heard a lot about PPE, or personal protective equipment.
Yes.
Yeah, and much to their credit, long-term care and home and community care operators, they've been working really hard to try and get enough PPE for their staff, but we know globally there's just not enough to go around. But what I have heard from experts, and we want to be mindful of this, is getting PPE is one thing, like making sure we have the supplies, but also we need ongoing training and support for staff on how to use that PPE without contaminating themselves. So as you can imagine, getting in and out of all of that gear, especially between multiple older, frail patients, is quite the process.
For sure.
And, and studies have shown that healthcare workers are more likely to contaminate themselves and potentially other patients when they're rushed, stressed, and in high pressure scenarios. So now, basically. So this is when they're gonna need that support more than ever. And the one thing I wanted to be clear about is I'm not suggesting that, it's just people in long-term care or support workers that need proper PPE training. Like even experienced family docs need refreshers and lessons on how to do that without contaminating themselves.
Well, certainly. I mean, we haven't had a pandemic in a while. So I think, as you're saying, a lot of these things we're honestly just not prepared for, nor have we actually visualized us ever having to go through this sort of thing in today's modern day and age. And I think absolutely your point of I think what I've been noticing in this discussion is that a lot of the issues that you mentioned that are behind the long-term care homes issues today, their solutions also lie with treating the issues that were present long before this pandemic. Which means, which I'm taking away as an understanding that if we took a better management approach, which includes workers, funding, equipment for long-term care homes, we may not have had this level of issue or these levels of problems that we're facing today.
I agree 100%. What we're seeing in long-term care is a direct reflection of, decades of not answering the call that long-term care and home community care has been putting out there. We didn't listen, and to really to save our seniors, we want to be offering comprehensive and robust supports to our frontline heroes. And when I say frontline heroes, I'm not just talking about the doctors and nurses, who of course are amazing, but also the PSWs, the home care staff, the janitorial staff, all those people, most of whom are women, who are under-recognized and underpaid.
Yeah, for sure. That actually brings me on to the next point. How do you see this pandemic affecting community-dwelling older adults? And what do you think as a system we can do to mitigate harm and mitigate risks for them?
Yeah, I mean, for community-dwelling older adults, the general public, mitigating risk, follow our public health guidelines. They're still in place. We're seeing data that people are getting a bit of a quarantine fatigue and venturing out. So I would just encourage everyone to follow those guidelines for as long as they're in place. But also thinking about people who are not in long-term care, and I think this will come to light in the coming weeks and months, is I don't want us to forget about other locations where older adults are living and receiving care. So justifiably, of course, the focus has been on long-term care, but we also have thousands of retirement homes across this country where older adults are living closely together. And more than 1 million older Canadians receive home care every year. So we just want to be mindful that as we move forward, we want to make sure we're learning about COVID and tracking COVID, not just robustly in long-term care, but also in home care, where we have equally frail and vulnerable Canadians receiving care, and they're also at a huge risk for infection. So it's really important that home care gets to be part of this COVID conversation as well, which I haven't seen as much yet.
Yeah, absolutely. I mean, that's critical. I agree with you. I mean, in the news, we've never actually seen PSWs or home care workers be a part of the conversation. And as you were mentioning about long-term care workers working in multiple facilities, we know that home care workers work in multiple homes. I remember in class you mentioned sometimes they simply just don't have time to take care of a particular patient because another patient in another home needs support.
Yeah. Yeah,
Yeah.
home care workers can be in a dozen homes in a day. And if you only have, 2 masks for your shift that day,
Hmm.
what are the implications of that? Yeah, there are other colleagues at UW and elsewhere who have said, we need to be much more careful about what is going on with COVID and home care, because we're probably not capturing as well as we are in long-term care.
For sure.
Mm-hmm.
That brings me on to our next question, our next sort of focus of discussion, which would be, what are some suggestions or possible resolutions you have to mitigate the strain on just the overall healthcare system? So not just frontline workers, but encompassing sort of the whole picture.
Yeah, well, I think there's some pretty significant learnings for our healthcare system in general and our care and our treatment of seniors. And if I'm being optimistic, I do think that this pandemic has really shone a light on the importance of care for the elderly, the value of the care that's being provided. And we need to do better for our seniors and the staff caring for our seniors. And with enough political will, I think we can, because other countries have done it.
Hmm.
And what's key to remember as citizens is, long-term care, home and community care, none of that's part of the Health Canada Act. That's all under local and provincial jurisdictions. So as citizens, I hope we remember this and we call on our politicians, especially in our provincial elections. I hope we remember this. How we treat our elderly should be a banner political issue. And, maybe COVID-19 is going to help nudge us in that direction.
So there's also a whole legislative component to it. So
Yep.
on a federal level, long-term care homes and home care are not federally sort of mandated. So it's entirely up to provincial jurisdictions.
Exactly.
Wow, that's very surprising for me to hear, and for I'm certainly for a lot of our listeners to hear as well. And this will now move me on to our last and final point.
Mm-hmm.
I know we just discussed sort of legislation right now, but on a more social level, what
Mm-hmm.
social norms do you see changing as a result of COVID? And how do you think these changing norms are going to affect geriatric care in the next coming years?
Yeah, that's such an insightful question. Thanks for asking that. Because COVID is not just about healthcare; it's about sort of the whole person.
Yeah.
And globally, there's been more than 230,000 deaths so far from COVID-19, and that's tragic. People have lost loved ones, people have died alone, and people have been denied last goodbyes. So all of that is incredibly devastating. But I will say that in all that tragedy, there also have been some positive outcomes that I think we can build on for the future. So I'll just give you a couple examples. All of a sudden, and this happened so fast, there are now billing codes so that healthcare providers can charge for virtual consults and visits. So anecdotally, we're hearing from physicians that these sort of telephone visits tend to be quicker, which is better for them because they're overrun, right? And for
Yes.
older adults who might have mobility issues, who don't drive, or have other reasons why it's hard to get to a clinic, it's a very positive thing for them to be able to receive care over the phone. So there's a place for virtual and telemedicine in our basket of healthcare options. So, I'm hoping that stays in place. I hope that's a norm that has suddenly been accepted. It's been built into the system on a billing financial level. And let's hope that stays in place. That's a norm I'd love to see change. And that sort of speaks to the broader sort of norm around technology. So, there's long been this notion that older adults don't use or maybe can't use tech, when in fact, more than half of all older Canadians are online. And again, anecdotally, we're hearing that older adults are increasingly embracing a range of technologies during COVID to support both their physical health, maybe a balance or an exercise class online, but also their mental health and well-being. So learning to use new apps to connect with grandkids, for example. So again, that's a really positive advancement and something I hope we can build on and leverage in our post-COVID world.
For sure.
Yeah.
I think there's a lot to be done, and as you mentioned, I think we are just about nearing the end of our really good discussion.
Mhm.
So I'm just going to pass the torch back over to you for some concluding remarks, and I think we'll just wrap it up then.
Yeah, thank you. You might remember from class when I taught the unit on home and community care, I finished that unit by saying, if you know a personal support worker, give them a hug, buy them a coffee, let them know they're appreciated. And while I might not suggest anyone hugging right now, the sentiment remains the same. Let's make sure everyone in long-term care and home and community care feels value, especially right now in these trying times. And let's make sure we do better by them, and the residents in the future. And I think if we want to honor all of the lives that have been lost so far, we need to make sure we remember and learn from this.
Certainly, I think that's a really powerful sentiment to go off of. Um,
Yeah.
Dr. Tong, I'll just take this opportunity now to thank you for taking the time out to have this discussion with us. I'm sure I've learned a lot from our discussion. I'm sure our listeners have learned a lot from this discussion. And I think it's really exciting. Some of the contents that we've discussed today, I think it's going to be really exciting to see them being on display in the next few months as this pandemic grows and hopefully comes to an end.
Yes.
So with that being said, I'm just going to be wrapping it up now. It was a pleasure speaking to you, Dr. Tong, and I look forward to see what happens next.
Yeah, thank you. Thank you so much for your efforts as well.
Thank you so much. All right. See you.
Bye for now.